Hi, my name is Cassidy Hanner, and today I'm going to be analyzing one of my favorite motions to do during exercise, the squat. First, I will go through the two phases involved in performing a squat, and then I will discuss the muscles and motions at each joint of this movement. In order to perform a squat, there are two phases, an upward or concentric phase and a downward or eccentric phase. To begin a squat, you should stand with your feet slightly wider than shoulder width apart, leg fully extended at the knee or tibiofemoral joint, and thigh fully extended at the hip or femoroacetabular joint. Feet can be slightly laterally rotated about 5 to 8 degrees, depending on what's comfortable for you. This is the beginning of the downward phase, or phase 1 of the squat. Phase 1 ends when the leg is flexed at the knee and the thigh is flexed at the hip. Feet are still facing forward and haven't moved from their beginning position. At the end of phase 1, this downward phase, your knee should not be over your toes and your weight should be held in your heels so that you can pick up your toes. This is the end of phase 1, the downward phase. Phase 2, or the upward phase, begins where the downward phase ended. It begins where your feet are facing forward, leg flexed at the knee, and thigh flexed at the hip. The upward phase ends where we began. Leg fully extended at the knee, thigh fully extended at the hip, feet facing forward and slightly rotated out if that's how you feel comfortable, and chest should remain upright the entire time. Now that we know the phases involved in performing a squat, I'll take you through the muscles and their roles at each joint during each phase. So during the downward phase, we have two joint actions. We have flexion of the leg at the knee and flexion of the thigh at the hip. During flexion of the leg at the knee, we have the mover of gravity. Gravity is pulling us down toward the ground during this joint action. Our antagonists will be eccentrically contracting in order to slow down that pull of gravity. These antagonists are the rectus femoris, the vastus lateralis, vastus intermedius, and vastus medialis, all muscles of the anterior thigh. The second action during this downward phase is flexion of the thigh at the hip. Our mover is again gravity, pulling us down toward the ground. Our antagonists will be eccentrically contracting to slow down that force of gravity. These eccentrically contracting antagonists are the gluteus maximus, the posterior fibers of the gluteus minimus and medius, the semitendinosus and semimembranosus, the long head of the biceps femoris, and the magnus of the adductor group. During the second phase, or the upward phase, we have two actions at two joints as well. We have extension of the leg at the knee and extension of the thigh at the hip. During extension of the leg at the knee, our concentrically contracting agonists will be the rectus femoris, the vastus lateralis, vastus intermedius, and vastus medialis. Our antagonist will be gravity. During extension of the thigh at the hip, our concentrically contracting agonists will be the gluteus maximus, the gluteus minimus and medius, the semitendinosus and semimembranosus, the long head of the biceps femoris, and the magnus of the adductor group. The antagonist working against these concentrically contracting muscles is gravity. Notice that between the upward and the downward phase, the antagonist and agonist switched. So the muscles that were eccentrically contracting during the downward phase concentrically contract during the upward phase.